What is your preferred mechanical files for removing GP and root canal retreatments?
Straight away, you want to try and remove the GP in one as much as possible. If I'm struggling, then I'll use a...
Can you use what's meant to be used as rotational as a reciprocating?
The best thing for you to do, and it doesn't make any sense at all, is just take the file out of the motor and then just put the rotary or reciprocation file in yourself with your hands, and you can feel that tactile feedback. You can push it to length. And then, believe it or not, the endodontic motor will still work if it isn't clipped into place. So you can just put the rotary motor over the end of the file. It's not clipped in place. You can turn it on and it will do the movement. Okay. What you need to realize is enjoy the learning experience when you're newly qualified, and don't be afraid to tell a patient you don't know and you need to see somebody else. If I was doing like a blind chat with a dentist, I could ask him a few questions about a few things and I'd know straight away how qualified they were, but based on their ability to say, I can't do this.
Hello, Protrusive, I'm Jazz Galati, and welcome back to part 2 with Dr. Samuel Johnson. This is the Endo Showdown. Rotary versus reciprocating. We covered a lot of ground in part 1, but we'll go for the kill. Dr. Samuel Johnson will reveal to you which is the best system, and more importantly, which system does he use and does he trust the most. We also answer a ton of the questions that were submitted from you guys on the Protrusive community app. For example, is there any use for NiTi K files, or are stainless steel files absolutely fine? Is there even ever a need or an indication for these NiTi K files? What is Dr. Samuel Johnson's preferred file for removing Gutta-Percha? What hacks and tips does he have for us? Can you use a file that was designed for rotation but in a reciprocating way? And is it true that certain brands of reciprocating files can bypass the glide path file? We'll answer all these and so much more in this part 2. If you haven't already checked out part 1, do check it out so you get the complete story. We'll put the link below. Now, every Protrusive PDP episode, we give you a Protrusive dental pearl, something usually you can apply in your practice, or sometimes they're non-clinical and mindset based. I've got a double whammy for you, okay? Number 1, when you are obturating, please cut the GP at the level of the orifice. I remember treating some cases before where root canals had failed, and I'm doing a retreatment case, and yeah, it made my job easier to retrieve the GP, but why was the GP so coronal, like almost up to the enamel, and it was just like so much sealer around it? It just promotes leakage, and actually that space is reserved for your coronal seal, for your restorative material. So don't forget to cut the GP at the level of the orifice. But the problem is, once you cut the GP, you have a really messy pulp chamber. And now if you want to now restore and create your coronal seal and bond to this pulp chamber, you want a nice clean pulp chamber. So how do you get that once you've seen sealer smeared everywhere? Well, if you're using something like AH+, which is a resin-based sealer, you should use a microbrush or a small cotton pellet soaked in isopropyl alcohol, okay? Because water and ultrasonic is not going to do it, okay? You need to use isopropyl alcohol, clean that pulp chamber, just give it a good wipe and you'll see it just instantly get so clean and shiny and glossy, and then you can proceed to do your bonding. If you're using a bioceramic sealer, it's even easier. You just use a little bit of water, okay? Just scrub that water in and it will clean your bioceramic sealer. It's a beauty of bioceramic sealers. If you're using something like zinc oxide eugenol based like Tubaseal, then usually a bit of air abrasion and ultrasonic is okay. I've read that you should use eucalyptus oil, but I worry about using that, so I just stick to using ultrasonic scaler and giving it a good wash, and also the air abrasion. Hope that covers kind of most bases, and now let's join this part 2 with Dr. Samuel Johnson. Catch you in the outro.
I do get asked a lot about, what is my protocol, and it's pretty boring. It's pretty much, using a size 15 glide path file. If you're not using a glide path file, use them. I think they shave about 30 minutes off a molar endo, because essentially, as long as I'm getting, I always get a glide path.
Is this a glide path pearl like specific one, or is it one that comes with a high flex system?
Comes with a high flex, although I use tooth saver file sometimes, because the high flex glide path file is although they don't say what phase the file is in, is it more authentic or is it more martensitic? Meaning, is it more springy or is it more soft? I think it's more towards the aus phase. It wants to straighten up more compared to a normal high flex rotary file, which you can bend at the end and it will keep that that shape. And these are great because what we notice with especially MB canals or MB orifices in an upper six, to get that tucked in, it can be really difficult, especially if the patient's not opening very wide. So if you can just kind of bend the file and you can tuck it in, that's really beneficial. So a lot of the times, if I'm struggling to get to length on a canal, and I can get to zero with my my hand file, but I have to make a little bend at the end because there's some kind of like sort of very microscopic ledge. With the high flex rotary glide path file, so this, I believe it's a 1504 or 1503. So what I mean by 1504, I mean it's a 15 ISO at the tip, and it's got either a 4% or 3% taper. I've noticed that with these high flex files, they want to straight up. So I use a tooth saver file, which is it still wants to straighten up, but I can bend it ever so slightly so I can tuck it right down into the canal.
With just for the new grads and those new to endo and glide path, we could have a whole episode on glide path. So just to make it clear, in the vast majority of cases, you get your access cavity, you ultrasonic away some of the roof of the pulp chamber, get them. You don't use Gates Glidden's, right? Am I right?
Never.
Yeah. I remember.
I just think they're too aggressive. And I know when I used them when I was newly qualified, I felt like I ledged really, really far up the coronal, in the coronal third of the canal. Now, if I'm ledging in the coronal third, great. Now, as I know what I know now, I think it's really, really easy. But I remember as a newly qualified person, I remember putting the hand file and going, this is stuck now. And I'm thinking to myself, I have no idea why this is occurring. So occasionally I will use these long neck, these gooseneck rose heads. But you need to remember as well, I'm using magnification, I'm using a microscope, so I can look really, really closely. So if it's all about this kind of straight line access. The straighter you are within a canal, the easier it is to shape, essentially, because you've got that kind of file gripping effect. So usually when you are not reaching to length, tip isn't getting stuck. The canal is usually holding onto the file, which is why you can't. And it's kind of this concept that it doesn't quite make any sense at all until you start to understand that if you're not reaching or you're not negotiating down the canal, all you need to do is just open up the canal space. And this goes back to the glide path file. So rather than, doing any sort of coronal flaring with a Gates Glidden, essentially I just get the hand file down there, size 10 or a size 8. I've been a lot of the time starting to just get a size 8 out now rather than a 10. Make sure you've got that patency, not all the way, maybe mid to coronal third, and then I'm getting my glide path file down there. And then what that's doing is it is opening up the canal or the canal mid coronal third in the orifice, but it isn't opening up so much as that you're destroying the pericervical dentin, because you need to preserve that orifice, because obviously you're going to be weakening the tooth. Now, again, it was a massive buzzword about 4 years ago, and I think it's got a lot of truth in it, but I don't, and again, I'm saying a very controversial thing here. I don't know to what degree it really matters. And the reason why I mention this is because it goes towards another kind of concept with files is taper. And what I mean by taper is how thick the file is. And there was a big sort of hoo-ha a few years ago about using these super, super small tapered files. And just, I find them difficult to obturate and clean with these types of files. But if you want to go down that route, again, one of the benefits of Rotary is you've got this kind of wider customization, haven't you? There's a wider sort of array of Rotary files that are different tapers. So, if you want to open up the canal orifice nice and wide, you've got these big fat tapers. And if you want to do little tiny preps, when you've got the Rotary. And I think really the main benefit of using a Rotary file is it's just got a strong track record, hasn't it? It's been used for many, many years. But it's
but in your protocol, though, the reason I asked that is because, like, you said you used the 8 file, and then you're pretty much straight to the glide path file. Are there any scenarios where maybe particularly sclerosed canals or whatever that you might actually be shy to use the glide path until you've opened up to at least 15 or something?
You make a really good point there. So my protocol is to try and get to length with a size 10. So I'm opening up the coronal to mid third first, getting a I exclusively now, I'm saying this out loud to everybody, I exclusively use D finders now. I very rarely get K files out. In fact, when I ask my nurse to get the K file out, she's like, K file? I don't know how well this would I don't know if I could try and move my, so these
Yeah.
are all my different ham files and things. So there's these tiny little boxes here, and when she has to get the K files out, she's always quite shocked. I don't want to get too bogged down in why I use K files and D finders. Essentially, we were talking about that gripping effect. With the K files, it's got like a cutting fluid all the way up the shank of the file. With the D finders, they're essentially a smooth board file. So these are more likely to slip to length. So as long as I've got the Canal patent and open, I'm onto a winner. However, if say I struggling to get down the Canal with a size 10, I'll then drop down to an 8. If I am struggling with an 8, I would very, very rarely get a size 6 out. I have known to, I mean, I use a size 6 today, but I feel like the size 6, they're too fragile. And sometimes you'll try and negotiate with a size 6, and it'll just, you'll be putting any type of pressure on this to try and negotiate down to the end of the tooth. But because it's so fragile, it's more likely to bend and push forward. So in fact, you might find a size 8 is probably a little bit more stiffer to get down there. So say I've got a Canal and used a size 10, it doesn't negotiate. And I've opened up the coronal to mid-third, so it's not gripping.
Again, the coronal to mid-third was open using your glide path file,
yes,
the rotary one.
So I'll get a size 8, and then I will reach length of that. It's at that point I'm not going to pick up the glide path file straight away. Okay, I will then try and open up the space with a size with a size 10.
D finder.
D finder, yeah. So if then I get successfully to length of the size 10, I'll then pick up the glide path file. So this is the Rotary 1503.
This is the second time you're picking it up, though, because the first time you picked it up was when you did the coronal third to mid. Yeah.
Well, what I would say is if I can't get to length of 10 and I'm struggling to get to length of 8, I have been known to pick up my final shaping file, my size 25. I usually finish with the high flex, and I will usually open up the coronal to mid-third with that. So really, really open up, because you're going to be using that file anyway. You know, you're not taking any more denting away than you require. So I've got patency with an 8. So I've got to length with an 8. I've got to length with a 10. I'm going to pick up my glide path file. The glide path file, the whole point of the glide path file is you want it to bring itself to the apex by itself. You don't want to be pushing on this file, because they're too thin. They'll break. Okay, and also if you have to push really hard with a glide path file, it's probably not. It's not wide enough to get down. So will I? This is one of your questions. One of the great things about D-Fine was it's got a 12.5 diameter. So I don't know if you've ever seen a in between file diameters before. So one of the really obvious things about, well, not so obvious to the general dentist, is they find it difficult to go from a size 10 to a size 15. And if you imagine in your mind, you think they'd just go up in, in these kind of like nice sort of file sequences. If you think about it, a size 10 to a 15 is a 50% increase in size. So if I'm struggling, a lot of the time I'll just get a size 12 or 12.5, and this is in between the two 10 and 15.
What color is it in between? Do they even have an ISO color for an in between? Has it got stripes on it?
Let me show you. Well, they're a light purple. Let me show you. See, you can go.
I've seen those because like a light. I would see. Influenced by my wife, who tells me to get these exotic colors of turbans, and I can see just one color. I would say that's a lilac.
So it says 12, but I'm almost certain they're 12.5. And what you'll also notice, and we mentioned this on the last podcast, I'm sure, this is a size 21. So these are shorter files. The benefit, again, if you've watched the other podcast, is a shorter file is less likely to bend, so you can push it a little bit harder. I've been known to shape up with a hand file to a size 20. The D-finders don't go up that high, and that's usually when you have created a ledge you know, it's difficult to sort of pre-bend these rotary files. Another really great tip, and again, I'm always wondering if I'll keep repeating myself here, because I mention this all the time on the channel, and also did I say it in the last podcast, is that you know, you might think to yourself, well, can't get the rotary or reciprocation file in on the motor, so you're trying to. You've done all the shaping. You can get to length of the size 15, say, and then you still put the rotary file in, and it's still getting kind of stuck, and you're not getting there. The best thing for you to do, and it doesn't make any sense at all, is just take the file out of the motor and then just put the rotary or reciprocation file in yourself with your hands, and you can feel that tactile feedback. You can push it to length, and then, believe it or not, the endodontic motor will still work if it isn't clipped into place. So you can just put the rotary motor over the end of the file. It's not clipped in place. You can turn it on and it will do the movement.
Okay.
But you've got to be careful, of course, is it'll probably stay in the motor, and you'll pull it out and you'll forget that it's not locked in. It'll drop on the floor and you'll have to get a new one. So and we do that trick a lot, especially with the high flex 20s, because they have got the 20s where you can make the bend. Essentially, yeah.
So you know, one of the questions submitted by the community was, if you were to go to a desert island, you'd be taking your high flex with you, and therefore, see, it's a difficult one, because you're not taking the high flex because it's rotational. There are so many other reasons why you chose the high flex, rather than the fact that, oh, I don't like reciprocating. And it's really the answer here to settle the showdown is a very humble answer, and say, hey, you know what? And it's universal in dentistry. It's what works in your hands. But my only concern here is there no thing such as that, hey, if I had like a recipe book, and I know there's no recipe book, and inclusion, there's definitely no recipe book, but like, if you have a curved canal, you should be using a rotational rather than reciprocating. Or if you have a canal that has X feature, therefore, out of these two options, obviously there's like a million different options because of the metallurgy and the taper and the size, but when we boil it down to just these two variables, rotation versus reciprocating, is there no other algorithmic decision making?
I don't think so, no. I think the reason why I use high flex is it's just a comfort blanket, and I'm sorry, Coltine, and I love the Coltine rep as well. I've got a really good friendship with Emma. I've known Emma for absolutely years, and I do some hands-on things with the Welsh government, and she always helps me out with high flex. But essentially, it's just, I think high flex caught me really early, and now I just use it, and of course I get given file systems, and I do use them. Again, what I would say is I do have WaveOne Gold files in the practice, not because I just I use it for different cases. It's because originally high flex didn't have these longer length files. So, the files come in different lengths, a 21 millimeter, 25, or 31. Well, high flex originally didn't have these extra long files. So you got these big canines that you have to shape. So we use WaveOne Gold because they were, they're long enough. High flex at the moment have just brought out longer files. So it's probably likely that I won't use a WaveOne Gold. So it's just like I say, it's just a comfort blanket. It's just essentially what I'm used to, and that's probably the most important. That's the take home today, is that you find what you like, and you just stick with that. My practice is I see a lot of consultations, and I'm seeing a lot of patients who just want a second opinion, or say the patient's been through the mill through lots and lots of dentists and seen this person, and a lot of times we know that it's a really common risk, but a filling's been done, the tooth's kicked off, and then the patient has lost confidence in that dentist. And a lot of the times during the consultation process with me, I just say to patients, I obviously say it's a really, really common risk, but also what I say to patients is, you might have seen dentist A, dentist B, dentist C, now they're saying seen dentist D. I say to them, do you know what, just choose somebody and just stick with them. That's the most, because again, you could get 10 patient, you can get one patient in the room, 10 dentists, and they'll just give a completely different opinions. I think just choose a file system that you like, and if you're getting good results with it, you stick with that. But again, I don't really use WaveOne Gold, but if you were to if I was a newly qualified dentist stuck on a desert island, I'd probably take WaveOne Gold with me, I think. Because the only issue with the reciprocation, of course, is that you need a specialized motor. Now, this was more of a case, a difficulty probably 10 years ago, but now I think most motors do both movements. I also think as well that trying to change the angles of forward and backwards on reciprocation I think that is out of my, I don't know what's best, but a lot of the times I will change the action, the rotary action, and also the torque, and when I'm using rotary files, because it's used for different, different types of canals. I like using the glide path file at quite a low RPM, usually about 300 to 350 revolutions per minute with a glide path file, but I'll always use it on the lowest torque setting because I know that that's my backstop. Then I'm using a very, very thin file in a very, very calcified canal. I don't want any kind of torsional fatigue. But when I'm using my higher rotary file, my higher diameter rotary files, I know it's been shaped, and these are just the final kind of shaping, and I will kick it up a notch. I also use XP-Endo. I don't know if you're aware of XP-Endo at all.
I've used it once years ago.
Yeah,
I'm trying to think what was unique about it. It's by Dentsply.
Yeah, so XP-Endo. No, I think is it a Dentsply? I think it might be. It's a purple Swedish brand. I can't remember what it's called. But so XP-Endo, it has like kind of a wavy sort of file shape.
It removes the debris really efficiently.
Does, yeah, and also it's great in
it's by FKG Dentaire. You're right.
That's the one. Yeah,
it's Swiss. So on Protrusive, we get asked geeky endo questions all the time, but one of the top questions we get is, which endo motor should I get? A good endo motor is so valuable, whether you're a busy practice or an associate who moves between practices. If you're doing a lot of endo, you'll value a good endo motor. We've teamed up with QU Dent to bring you a special promotion. It is the Endo Radar Pro. I had a product demo of this a couple of months ago, and the cool thing is that the head itself has got a free form rotation. That makes it way less awkward to read your apex locator measurement, because it's not only a motor, it's also an apex locator. And when you have a fixed head, it's sometimes difficult to read the screen. The freeform rotation really allows you to get better access to all the canals as far back and as awkward as you want. With other motors, you have to detach and then reattach the head, but this one has a freeform rotation. The other trend we're seeing that this satisfies that when dentists are nowadays buying endo motors, they no longer want the screen on the handpiece itself. That is getting too cumbersome, too fiddly to go up and down and try and get the right settings on the handpiece. So we've gone back to favoring a large screen, and that's what this one offers. Dentists want to be able to put the endo motor on the bracket table right next to you and see the screen and see the visuals. It makes it so much easier to toggle file systems, toggle speeds and torque. The motor then connects to the handpiece via Bluetooth, so there's no wires, which is great. So you still get the feel of a wireless handpiece, but all the settings are conveniently changed on the motor itself and not on the handpiece. Not to mention it's more ergonomic this way. The Endo Radar Pro comes with an autoclavable head. That's actually where you insert your file. But if you're limited to endo, you're a specialist, then you probably want to buy a couple of additional heads. The promotional price in total is less than £650. I say less than because I like to quote with including VAT always. And so once you do the checkout, enter the code, it'll be way less than £650. And there's another perk coming as well. You get to choose some free files. You can either pick solo files, which are similar to WaveOne, or you can pick M Taper, which is similar to Pro Taper Rotary. And when I was learning about these files, they've been sold for 7 years with an 80% customer retention. So now you can get a new endo motor, plus you get to try a new file system. So you get to choose Reciprocating, aka Solo, which is similar to the WaveOne, or you could choose Rotary, which is the M Taper, which is similar to Pro Taper. All of that with the discount and the files is done on the checkout. The website to claim this is protrusive.co.uk/endomotor. That's /endomotor. And as always, your coupon code is Protrusive. This offer is time sensitive, so in the first 30 days, that's when you get the best pricing, or until sold out. So check it out on /endomotor. Let's rejoin the episode.
Premium brands. You open that box and you think, wow, this looks
of course, it's Swiss.
Incredibly expensive, yeah. But there's another file, I believe it's I think it's the finisher, where it's shaped like a half moon, and it comes in like a sleeve. And then when you blow, your endofrost onto it, it straightens out. So then
Yes.
you get it into the canal, and once it reaches a warmer temperature, it like expands out again. And they're used at 1,000 RPM. That's fast. But I think another file I use other than HyFlex is I use a lot of tooth saver. So I've mentioned before, I use their glide path file if I'm struggling to get to length and I need to make a little bend at the end. I would say the tooth saver, you can't make a proper bend, but you can make a better bend than, say, in a HyFlex. But I also use their 2007 tapered files for retreatments. So when I use this, so when I say 2007, again, the 20 is the tip and the 07 is the taper. And I believe that the 07 I'm not too sure, because what you see with these tapers is sometimes they are a continuous taper and sometimes they level out. So I suppose if you had a continuous taper of 7% all in the file, it'd look like a Christmas tree, wouldn't it? These files are used again at 1,000 RPM, quite a low torque, and these just cut through GP like a knife through butter. Issue with using rotary files, we were talking about reciprocation. It's got a more propensity to be pushing debris out to the end. I think even if you use a rotary file really, really fast, close to the apex, you're going to be pushing stuff out for sure. And when I look at the comments on my YouTube videos, and people again constantly say they say the same things. Why aren't you using sort of mechanical way of removing GP? But in the first instance, I'm always trying to remove the GP with hand files, with H files, and I've spoken to many endodontists, and they think I'm just taking too much time. But I think using rotary files really, really close, or reciprocation files really, really close to the end of the apex, when you're trying to remove GP, you're always going to be pushing GP out at the end. Now, there's a massive sort of, does it matter? Obviously, you'd like to think you're not going to get any extrusion at all. But to me, it's just, I don't know, I'm always trying to get that perfect post-op radiograph. And a little bit of material is not great for me, I don't think. And I don't think it's great for the patients either.
As they say in Endo, the thrill of the fill, right? Now,
exactly.
Taking a few things that you've spoken about in the last couple of minutes. One was when you say to patients, just choose someone, right? And I can really resonate with that. And it's the same advice I give when dentists ask us in our courses, okay, look, which composite system should I use? And so the first part of that is, well, stop chopping and changing between the composite systems. Don't go Kulza one week, then do GC the other week, and then do, Cold Team the other week. You got to really pick one and spend a good few years, right, trying to hone your skills and trying to learn the ins and outs of that system before you can truly, you'll master it. You'll end up loving it, enjoying it, because the handling, it all comes. So I think definitely there's a lot of similarities in what we're saying here. And then the other thing I say to dentists actually is, you know what, you're stressing over which composite system to use, but actually the composite system you use is probably 8th in the list of what makes a lovely composite, right? So let's talk anteriors, right? Number 1 would be shape. Okay. Number 2 would be, let's say, the line angles, right? Number 3 would be let's say, the surface texture. Number 4 could be the shade, right? Being lower down, not being as important as the shade and all those other things, right? And then there's various other things. And then which system it was probably number 8 or something. So in a similar vein, if you just make up some numbers, right? Like, how important is that one variable of reciprocating versus rotary? If you were to, like, for example, for successive endo, chemomechanical, like use of hypochlorite is probably number 1 or something, right? Isolation is high up there, right? Where is this variable of rotational versus reciproc and the file system chosen come into it?
It's very low. I think I know loads of dentists, loads from university through doing courses and things, and I would say most dentists just, I want to do this thing, tell me how to do it, and I can start doing it. And I suppose in dental school as well, I always used to get really, really frustrated with the clinicians who I used to say, well, what would you do with this? And they would say, well, it depends. And what would you do? Well, it depends. And And I think if you're a newly qualified dentist, you want me to say, use this file this way and that. And the thing is, if that was true, you'd get dentistry really, really quickly, and then it'd be really, really boring after a while. You just sort of do the same thing over and over again. One of the benefits I think of this job is just it does depend, and that's what makes it incredibly exciting. I think I go to work every single day. I've said this before, and I look forward to it. Every single root canal, even if it looks really, really, really simple, there's always something that's a little bit different. And I also think that is the whole point of why these Friday clinical cases that I do every Friday on the YouTube channel, they're so easy to find because every single case is just different in that kind of little way. And what I'm trying to say is, I know if you're a newly qualified dentist, you're listening to this and you just want to be told what to do because it's just easier. Try and embrace this kind of concept of like, it really does depend, and enjoy the journey of understanding that, because that's the whole point of I think if you went to work and you absolutely hated this job, I think it'd be absolutely miserable for you. If you're forced me to give you an answer, I would say WaveOne Gold. Just on my personal experience, I have nothing to do with WaveOne Gold. I hardly ever use it. I think it's a really, really good and easy
GDP
system
friendly.
It is really, really friendly, and it's a one file system. You touched on it before. To me, I love this. So I'm like, when I'm I was thinking about this podcast today. I'm literally just a root canal as I sat, the patient left, we sat down and we did this podcast, and I was just thinking about my files and I wonder if this will work. It's really, really fascinating. It's absolutely fascinating. I'm at this point now because on a lot of the things I'm on autopilot, so I understand something happens, I just know straight away what to do. But when you're qualified, everything is up in the air, and you're absolutely just. Sometimes you feel like you're drowning a little bit because you're not too sure what to do. And that's really, really important to get some sort of mentor, even if it's just someone else in the practice who's happy just to talk to you about things. But the great thing about WaveOne Gold is that it is just simple, isn't it? It's just another one of those things you don't have to worry about. But it's definitely not a file system which, with every single case you could use it as a single file system. But again, HighFlex, another single file system. So just try again. You must hear this all the time. Get extracted teeth and have a go. But and I know that some dentists think, I haven't got time to do that. I'm on my lunch break. I'm probably I'm writing letters. But you know what? It helps so much. Just to have a little go on some extracted teeth, and also go on courses. Go on some super.
Because you
see
might
them
go on your course and learn about HighFlex. You might go another course and they absolutely love this one particular system, and they'll give them reasons. Have you experienced this? Have you experienced that? And you're like nodding, yes, that's me. Well, this file system, obviously there's marketing and fluff, but this file system will help you with this. And because that's a big problem for you, it's a painkiller for you, you will then resonate with that. And then you then develop another, like for example, composite. You use Colza for 4 years, and then you get introduced to GC and it intrigues you and it solves some of the problems that you might have had with another system. But then once you've tasted both, you can then decide, actually, I do like this other system more. Or you might find that, for these scenarios, I like this file system, and for those scenarios, I like this file system. And I guess with class 2, taking it back to class 2s, I have that. I know that for certain types of concavities, I'll use one matrix system and one for the other. And there's no substitute for experience when it comes from that.
And obviously the other issue with being a dentist is obviously patient management, isn't it? And you might think to yourself, I need to tell the patient, when you're newly qualified, you want to feel like you can do everything, and you want to give this kind of facade of the patient thinks I'm dead, they're good, and everything, etc. But what you need to realize is enjoy the learning experience when you're newly qualified, and don't be afraid to tell a patient you don't know, need to see somebody else. Do that. I think one of the if I didn't know, if I was doing like a blind chat with a dentist, I could ask him a few questions about a few things, and I'd know straight away how qualified they were. But based on their ability to say, "I can't do this," I'm gonna send it to somebody else. And it definitely not don't feel bad about yourself if you can't feel like you can't do something. Most patients understand, and again, I think if a patient, I think if a patient's going to be uh, upset about you being honest with them, they're the wrong patient for you. The best,
And therefore, you get to then eliminate that risk element of taking a patient that doesn't.
That person out.
It's a great filter. And
consent is.
Go on. Sorry.
No, I want to hear you go on.
Well, an old episode we did with Dr. Barry Glassman, probably like episode 15 or 16 or something like early, like years and years and years ago, right? Dr. Barry Glassman, lovely chap in the States, TMD guy, an orofacial pain guy. He said this thing that just the beauty of being able to smile at a patient and say, I don't know. But there's a way to say it, like you say it with confidence, like, I don't know. And there's a beauty in that. Or sometimes it is not known because it genuinely isn't not known. So either if you don't know, but someone else might say, I don't know, but I know someone who does. Or it is not known and say it with a smile and with some conviction and confidence. That has a lot of value. I'd love to hear what you're going to say about consent.
I love it. Honest to God, I have a really good friend who's a specialist endodontist, and he thinks I go too far on consent. I do go pretty deep into it, but I suppose that's just my own sort of personality, really. I'm an ex-worrywart. I'm definitely not worrisome as much as I was before. So when I work in two very, very big practices, and we get a kind of a turnover of newly qualified dentists. We used to have a VT here, and when they come in and they're really upset about something, or they're worried, to me, I'm like, oh, I've got to help this person. I've really got to. And a lot of times it's just you just got to, it's not to worry about it too much. If you are a worrywart, it will definitely get better over time. But I think for me, consent is huge. I also think I've got this theory about, I think, again, if you work at practice for many, many years, you build up a big sort of a load of patients that you know really, really well. I think the patient reflects the dentist.
Always.
So we used to have a dentist, lovely dentist, honestly fantastic. But she had this person had a personality of just being very high strung, and all of her patients were really, really high strung, And I'd love to know what what my patients are like. Who knows? I don't know. But I think it's not done deliberately. I just think you just generate the type of patient. The type of patient that stays with you is the person who you are, I think.
People don't buy dentistry, they buy you, right? People don't buy dentistry, they buy you.
100%.
And so that becomes, in general practice. Obviously, it's not going to happen in 1 year of practice because you haven't built any report yet. But by about 5 years, you get to a point where the patients are reflective of you, and that's a very telling thing. In the interest of time, I'm going to ask some questions from the community, right? So there were so many questions, brilliant ones that were sent in from the community. But before we just take these community questions, you said something earlier about how young dentists want to be told, do this, if this, then that, like a recipe book. You just literally took me back 13 years. You took me back 13 years. I was there in a room, our very first DF1 study day, and Raj Ratan was on my TPD. He asked a question. He said, okay, raise your hand if you like rigid protocols and you want to be just told what to do. And loads of hands went up, right? And then it was like, okay, put your hands up if you don't mind that there's many different right answers, and a fewer hands went up. But you know what? I retrained my mind, and what I've been teaching on our community and stuff is there is a beauty of dentistry. If you change the lens, if you just swap over your lens and you just put the lens on, that actually this thing that there are 10 different ways to do something, it is not a bad thing. If you see it as a beautiful thing, that actually you got 10 shots of doing it and you can still be right.
It's fun, isn't it?
It's fun. It's what brings the fun into it.
And I like when I have a dentist come in and ask questions, it's fun to talk about it, isn't it?
Mm-hmm.
A lot of times, it's kind of like, well, you could do it this way, you could do it that way. Sometimes the dentist comes in and I wouldn't say upset's probably a wrong word, but they're flustered, and you just go, do you know what? Just do it like this. I think that again, you just need to grasp, I think, how fun and interesting this job is. I think that the people who are after these very, very rigid protocols, what will happen is you will break those protocols frequently, and then in your mind you will think to yourself, well, I've done it wrong. We haven't done it wrong.
It's like a cognitive dissonance. You feel at unease with yourself, but actually you haven't done anything wrong. It's just you were too rigid in your mindset.
Yes, absolutely. And this is where it all comes into consent. The whole adage of undersell and overperform. It's such a cliche. God, it's so true. It's so true. And if you got a patient who's over demanding, you just straight away. Joe, I always feel like the people you bend over backwards for the most are the worst patients, because they're the ones that they're never appreciative. Never. Always the same people, because they always want more. I'm not saying when I say they want more, I'm saying they're it's the expectations are they're unreasonably high. But I think maybe it's the part of the world that I work in, but I would say 99% of the people I come across are rational people.
But yeah, with experience, you learn to learn you learn who isn't, and therefore that's when your filter becomes stronger. Now, in the interest of time, Sam, I'm gonna ask you a question. You must answer with 45 seconds or less per question. Okay, so we have to throw everything we said in the last 1 minute about actually there's beauty and there's millions different ways and fluff. You have to now tell me straight, buddy.
We'll say that the dentist who's asked these questions coming in, they're in a fluster. Patients in the chair.
I am the flustered dentist, and this flustered dentist wants to know this flustered dentist in particular is Dr. Roxy. Roxy says, what's the benefit of a file system like WaveOne versus Reciproc? So these are two different brands, or maybe are they brands? Maybe the same company. I'm trying to think. VDW comes to mind.
No, not the same company. But weirdly enough, they were created around the same time by different people. So
it's Reciproc versus WaveOne.
Reciproc, very, very grabby. So it wants to drag itself down, especially the early Reciproc. I don't think I've used Reciproc Blue just yet. And I think that WaveOne Gold is probably just a bit more, unqualified friendly. One of the reasons why I went from WaveOne to HighFlex is because I just felt like it didn't have that kind of cutting efficiency.
Okay, wonderful. Now, you already touched on it, but just to summarize what you said, what is your preferred mechanical files for removing GP and root canal retreatments?
Headstrong files straight away. You want to try and remove the GP in one as much as possible. If I'm struggling, then I'll use a rotary file. So I'm using a tooth saver file, 2007. Dead sheet files, very, very efficient. You've got to worry about extruding out the end. And I never ever used to use it, but now I've started to use solvent. Actually, we take the X-ray, you feel like you've removed all of the GP, and you can see a little tiny bit at the end, but I can't quite remove it. Solvent is a great little backstop. You just be dead careful with solvent. Don't use it too early, because you'll smear it all up the walls and it'll be impossible for you to remove.
Got it. Christopher asks, can you use like your HighFlex, but in a reciprocating way? And then also the second part of that question was, can you change, like if you're going clockwise, can you just use it in the different direction? And he says, instead of buying different files, why not use the same file in a different mode? Aside from that, I would like you to ask him about the possibility of cracking teeth and extruding debris when using Reciproc. We've touched on that already. So really, can you use what's meant to be used as rotational as a reciprocating?
You can use whatever you like, I suppose. Is it efficient in that way? I also know, again, I talk about tooth saver a lot because I know Daniel really, really well. He's a really good mentor, actually. I get a lot of advice off him, and his tooth saver files can be used in reciprocation or rotary. But I would stick, if you're not sure, I would stick to what you know. I suppose in a way, if you're using the rotary files or reciprocating files off license, as probably say, is that you're more likely to fracture the file. I know that the one of the first papers on reciprocation, they used a ProTaper file, so a rotary file, to see if it would work in this reciprocation mode, and it did. When I think stuff like that is left to when you are much more qualified, and of course, if you're going to be doing that, I'll be doing on extracted teeth first before you're sort of making, it wouldn't be in the patient's best interest, would it, to be using it in different ways.
I'm sure you'll find Mustafa on your YouTube channel giving you love and comments. He's one of those guys. He's a really cool guy. And he's very experienced, actually. He's very good at endo. And so he's got the license to experiment and do that, which makes sense.
I'd love to know his opinion on that. That'd be interesting.
Yeah, we'll get him to post it. He'll post it on the app straight away. So in terms of curved canals, it's because the question is about efficiency. So Ty Christensen asks, which is more efficient? So we're talking about speed and efficiency for shaping curved canals. So reciprocating the straight rotational, is there one that could be more efficient if that's the metric that you're looking at?
I think the marketing around reciprocation files is that it's more likely to be centered while it's being used. When you're more centered, of course, within the canal itself, you're less likely to ledge. And that's your main issue, essentially, with curved canals, is that that risk of ledging. I don't think there's any difference between the two. Although I keep banging it home with these glide path files. I think these are I think they cut a truer glide path than, say, hand files. And I think if you're the rate limiting step or the thing that is important isn't the reciprocation of the rotary, it's probably taper and ensuring a glide path for canals.
Super, that makes so much sense. And the last question is Harper Deep, who's a long-term Protrusive and one of the loveliest dentists anyone will ever know. And she has a really good question, which ties in so nicely with glide path, right? She would like to know, Reciproc Blue files, she's hearing that it can bypass your glide path files. And so she says, in her own words, so probably very similar to what you are thinking, is it's hard to let go of using glide path files or hand files for initial instrumentation. So I don't know anything about Reciproc Blue or these claims, but any thoughts or experience or encounters with this?
So I don't use Reciproc, but one of the kind of the whole point, the reason why Reciproc was created was could they create a file that did everything, and it did need a glide path file. So I think the original sort of USP of Reciproc was you don't need a glide path file. Personally, I've had my fingers burnt too many times where I've just gone straight to length without a glide path file. And I suppose in a way, I always think that if someone was doing a root canal on me, and I'd want them to always just be doing those safe backstop sort of ways of working. I wouldn't want them just to be like, well, I just want to be quick, so I'll just drag it down there, sort of thing. So I'm not saying she's dragging it down there, but I would say the amount of times that I have gone with the file, I'll just go a little bit further, and then it's ledged. So many times. And it catches me out now. If I can't get to length, I'll shape it a millimeter away from where I've reached. Sometimes I'll just slip it a little bit further, and it always ledges. Personally, I would always just use a glide path file every single time. But
it just makes sense.
Yeah, I'm not experienced on Reciproc at all, and you might get somebody who uses it all the time. I couldn't comment.
It all boils down to risk analysis and insurance, and whilst if they market that and they say that, there must be some degree of in their testing they found that they were able to bypass the glide path, but then to say, does this introduce a risk, is a logical thing. There is a risk, maybe there is some degree of risk. And like you said, to be a bit cautious is your style. And, if that works with your style, it may be it. And that takes us to the end of a very grippy episode indeed. Sam, thank you so much once again for honoring us with your presence, with your humility, with your passion, with your enthusiasm. You're absolutely golden. Please continue making those wonderful Friday morning videos as Ben loves, and generally all the cases that you post and YouTube and Instagram. So please guys, I'll link below to all of Sam's stuff. You need to check it out already. Is there anything else that you'd like the viewers and listeners who already love you so much to check out?
Nothing. Just keep commenting. We've also got I've started to do a giveaway. So we're giving away a brand new Root ZX3 Apex locator when I hit 30,000 subscribers on YouTube. All you need to do is subscribe and comment a question. That's all we're asking you to do. So just go on there. To be honest, I've learned so much from so many different people. Restorative, and it's absolutely golden, all the comments. So just keep the comments going, and that's all I'd say about that.
There we are, guys. Keep commenting, including on this channel as well. Sam, thank you so much for everything. I appreciate you. I'm sure I'll catch you again. If we keep doing this yearly thing, that'll be an absolute, if anyone's in for a treat. Thanks to you, and have a great rest of your day at clinic.
Lovely.
Well, there we have it, guys. Thank you so much for listening to this part 2 with Samuel Johnson all the way to the very end. You guys are the true Protruserati, the true geeks and the nicest people in the world, as per all the members of Protrusive Guidance. If you're not already on our app, please join. Head over to www.protrusive.app, make your account on the web. And once you've made your account, you can use those login credentials on the iOS or Android app. For those of you who are full members and premium subscribers, scroll down, answer the quiz, get 80%, and our CPD Queen Marie will send you your certificate. We release approximately 16 new hours of CE every year, brand new, as well as the back catalogue of over 400 hours of quality CPD. We are a PACE approved education provider, so whether you're in the US, Australia, UK, anywhere in the world, we've got you covered. And our app and our community really is a melting pot of all the dentists from around the world, from even remote islands. It's amazing how we've managed to attract nice and geeky dentists from all corners of the world. So if you're not already on there, please do head over to the app. Also, don't forget, if you're interested in that Endo Motor, head over to protrusive.co.uk/Endo Motor. The deal will end in approximately 4 weeks or until sold out. That will then be replaced with a less of a deal. It'll still be there, you'll still get a small discount, but the money off and the free files is relevant right now. So head over to protrusive.co.uk/Endo Motor. Thank you again for listening, and thanks again to Samuel for being a great sport. I'll catch you same time, same place next week. Bye for now. And don't forget, by the way, to subscribe to Samuel's channel as well as this one if you haven't already. Thank you.